Transcatheter mitral valve repair is a method which consists of devices where we can actually repair the mitral valve by applying a little clip or some other devices without open heart surgery. We advance these catheters through the groin under anesthesia and under echo guidance, and then we place these clips in an appropriate position on the valve to help reduce the leaking valve. These procedures have a lot of advantages to patients. Number one, they're less invasive. They can be done without actually stopping the heart or cutting the chest. And the recovery is very fast, and usually they go home within a couple of days. Therefore, it's very attractive to both patients as well as referring physicians. There are, however, some limitations. Because there are only a few techniques, they're not applicable to all types of leakages. So there are certain types of valves which are amenable to this procedure. So when we see a patient, the first thing that we do is we quantify the leakage. If we think it's severe, then we actually do a detailed analysis of the mechanism of the leakage. And there are only certain groups of patients where the leakage is amenable to this therapy. The other people who cannot be repaired transcatheter-wise can undergo surgery. MitraClip, which is a transcatheter mitral valve, is being approved in the United States for the treatment of high-risk primary MR and also certain patients with mitral regurgitation with a weak heart or low ejection fraction. We are now trying to expand the indication to patients who are intermediate risk for surgery. So they're not completely non-operable, but intermediate risk. And so there's a clinical trial which is actually going to randomize patients who are intermediate risk to open heart surgery to either open surgical repair or transcatheter mitral valve repair within the MitraClip. And I'm lucky to be the national principal investigator of this clinical trial, along with Pat McCarthy from Chicago.